I'd like to tell you about our two major national projects, the Coordinated Veterans Care Program and the Flinders Closing the Gap Program. The Coordinated Veterans Care Program is funded by the Department of Veteran Affairs. It is targeted at veterans in the community who have complex and chronic conditions at risk of hospitalisation. And we've been funded to develop 4 online modules plus a face-to-face program and use of manuals and DVDs. 3 years into the program, we've had over 4,500 people trained either using the online program or the face-to-face program, and we have a greatly increasing interest from across Australia where general practitioners working with practice nurses are being funded to provide coordinated veterans care over and above their usual practice. This is a revolutionary model for the Australian healthcare system. If it can work for veterans, it can work for the rest of the population with chronic diseases. The second program is the Flinders Closing the Gap program. A key element is the revised or adapted version of the Flinders tools called My Health Story. This is really addressing issues around literacy and cultural appropriateness, where the tools are now in a booklet form using a lot of graphics that are easy to understand and adaptable by the health worker and the Aboriginal person. And we found that there's been wide acceptance across Australia in this new set of tools. We've been funded to provide training in the Flinders program across Australia. We've trained over 1,000 health professionals and Aboriginal health workers in the use of the Flinders tools. After 3 years, over 5,000 Aboriginal people have had a self-management care plan, and over 59,000 occasions of service related to self-management have been achieved across Australia. We've also been funded to implement or support implementation of self-management with organisations. This has proved to be highly successful. We have now over 81 organisations who've signed a memorandum of understanding about the shared responsibility and goals that we intend to achieve over the next 12 months in implementing self-management care planning using the Flinders tools.